Welcome to Pharmacology by Lecturio. I'm Dr. Praveen Shukla. We're going to talk about drugs in hypertension today. When we talk about drugs in hypertension, it's a huge class. So I'm going to go over each of the classes one by one. We're going to divide up the classes into two types of classes. The first type are drugs that act through the kidney or hormones made by the kidney. And the second type of drugs, or the second class of drugs, are those that work outside of the kidney. Let's talk about renal drugs used in high blood pressure. We have diuretics, and we have angiotensin antagonists. Now, the angiotensin antagonists are divided into two major groups: the angiotensin-converting enzyme inhibitors, or ACE inhibitors, and the angiotensin receptor blockers. Now, we do have another category called the direct renin inhibitors, and there's only one drug in this drug class. We'll cover that as well. So there you have it. Those are the renal drugs in high blood pressure control. Let's take a look at the extrarenal drugs that are used in high blood pressure control. We have, in the first group, agents act through the sympathetic nervous system. These drugs include sympathetic outflow tract inhibitors, drugs that work on the ganglia, drugs that work on nerve terminals, and drugs that work on either the alpha or the beta receptors. The other class of drugs are the direct vasodilators. Those can include calcium channel blockers, potassium channel openers, nitrodilators, and endothelin antagonists. So these extrarenal drugs are a fairly large class, but as we go through the lectures, you'll realize that the drugs that are on the left side of the screen are probably less important from a clinical point of view, but they are still going to be on your exam.